Hey, everybody, welcome to another Conversations and Cases episode.
Mm-hmm.
So here we go.
We're having coffee this
I
morning,
know
getting
we have.
ready for work, and we were chatting about,
We've been chatting about this one
well,
for a
all
week
week
or
we've been
so.
talking
Yeah.
about how many gastrointestinal complaints we've seen in the office.
That's
And
a
not
compliment
just
for a
this
guy.
week, over the year. And so we are going to have a little chat about that, and then our cases on that too. And I
Yeah,
have
it's
so many cases.
misunderstood. And I think you were given statistics that it's affecting a massive number of people.
Well, 2 out of 3 people have, if you, when they did a study and looked back like over a week, 2 out of 3 people were having some complaints. So that could be
That's a ton of people.
bloating, pain, gas, constipation, diarrhea,
And it's not necessary.
reflux,
And then we want to get
indigestion.
into this conversation is about it's impacting people's
Yeah.
health. um, in ways that we shouldn't be. So if our focus is healing the healthcare system and helping people to live a high quality, optimal life, as a physician, that this is a critical area of one, education for our patients, and then also the opportunity to recognize these symptoms and then find ways of bringing the body back to balance.
Yeah, 'cause it's hard because I think we're all different, we're all unique, and so a lot of times as I dive in, because I've really been focusing so much on gut health this past year and a half.
You said it's a
I've
big
had
one. I mean, it's
Yeah, I have
something we
more
want our patients
time,
to
and
understand.
I think a lot of times people don't know like what is normal and what is abnormal. So to not go to the bathroom except once a week, that's not normal. Or to go, 5 or 7 times a day. People once I'll ask, do you have diarrhea, constipation? No, and then when we dive in, it's like, oh, that's not normal. Or to have like excessive gas or distension as soon as you eat, or to have to take an antacid every day, like that's not
Oh boy,
normal.
yeah.
And so, I thought we should just talk about normal digestion, normal healthy function,
Right.
and then we can dive into our case.
Because doctor, how does it work? How does digestion work?
Well, and so the whole purpose of digestion is to take the food, the fuel that we're putting into this vehicle, into this body of ours, and to make it so that we can utilize it, right? And to extract out like all the vitamins and
There's a
minerals,
lot of stuff.
and to get
Normally,
the
good food, healthy
proteins and
food.
carbs and fats and all of that. And then we use those minerals, and we use all those nutrients and vitamins
Vitamins.
and amino acids to build our body, to use it for
Move our body.
energy, to move our body, to build organs and muscles, and to also make chemical reactions occur, or to make like hormones and neurotransmitters, right? So people don't realize like our mood chemicals need certain vitamins and minerals. They're called cofactors to make these work. To also, we manufacture energy, or ATP, and we have to use these vitamins and minerals. So our body is so complex. So anyway, digestion, it starts when you look at food, right? So you look at it, or you think about it, or you smell it, and that gets maybe your juices going in your mouth, and
Your
it gets your
amylase.
enzymes flowing, and prepared for being able to process it. And then the chewing action, which we Americans are in a hurry. We often like eat really fast, or we don't chew well, and swallow things whole. And so the chewing really also is that breaking down so that we can start getting things processed and be able to extract
What
things
was? I
more.
mean, you're supposed to like how many?
I don't know.
You're supposed to chew so
Chew.
many times.
Yeah.
I was
That's
always
a
the
good.
first one done.
You still
I
are.
know. I've slowed down a little bit,
Yeah, you
but
have. You have.
a little bit, not a lot.
Intentionally,
Um,
you've been more
maybe or maybe
conscientious
not.
of
Who
it.
knows? But
Now, on the other end, your brother is a very nice, slow
and
eater,
mom
and you're, which is
and
good.
Herschel.
And yep, so it's good. It's good that to take your time with that. It helps the digestion.
Well,
It
even when we
helps your
were in
body.
France, their whole culture
Yeah.
is
Oh, that's
focused on
true.
take
That
your
is interesting.
time.
Uh-huh.
We'd take 2 hours to have a meal,
That is so
and it was so
funny. You're
nice. So
right.
it was more enjoyable.
Mm-hmm.
It probably helped our digestion more.
I think it did. I had zero digestive complaints in France.
So we got the thought, amylase,
Mm-hmm.
enzymes, mechanical movement of the
Yeah,
mouth,
then
and
it
then it
gets
goes
down into
starts
your
to go into the body.
esophagus, and so and your esophagus hooks to your stomach. And so people hear a lot about gastroesophageal reflux, but disease, GERD. And that is really just the food contents in your stomach come back up, right? And so it could be, sometimes it's mechanical, like that little valve between our esophagus and our stomach.
Doesn't
A
shut.
lot of times it's overeating, eating right before bed, eating, um, drinking alcohol, eating spicy foods or fried foods.
Oh
Things
my
that
gosh.
relax
All the
that,
things I love. No.
that relax that sphincter or that valve that's supposed to stay closed.
Interesting.
And so, sometimes it's that. Again, then we move on into our stomach. And again, the stomach acid that is supposed to be in there, we need stomach acid. Um, since antacids became over the counter, I mean, we're getting into a little bit of a problem where people overuse them. Every digestive complaint, I mean, people are popping these like candy. And so I think if you are, you should probably step back and think, why am I needing this every day?
Right.
And because as we're going to talk,
Because the acid's there to break down the food even to smaller elements before it gets into the small intestine.
And like help us extract and be able to absorb B12 from food. So sometimes a lot of people are deficient on B12 if they're chronically taking these antacids or the proton pump inhibitors like Prilosec and stuff. So so it is important, and we'll explain a little bit more about that in the case. And then you've got other enzymes in your stomach, and your stomach dumps out into your small intestines, and your gallbladder and your pancreas are used there. Digestive enzymes get out. And then the small
Hopefully
intestine.
things at this point are tiny, like at the vitamin, the mineral, the elemental,
in that small intestine,
as far as
because
possible.
that's where we start absorbing and extracting out all those. So yes, if things are not getting broken down, they're just getting dumped into your small intestine.
I think we were reading that when it doesn't, it goes rancid.
Especially if
which is like not taking your trash out. You miss a week of not taking the trash out and the garage smells. Same thing's happening in our bodies.
If it's slow to move through, then that's true. Everything just kind of sits there. And then those bacteria just like feed off of it. And that's where then those bacteria are producing gases like
talk about how many
hydrogen
bacteria we have in this body.
Oh my gosh. We have like trillions of
more than
bacteria.
The cells in our body.
Yeah,
we have more bacteria than cells.
More human cells in our body. I know.
People are like,
crazy.
oh, I have a bacteria. I was like, yeah, you are bacteria.
And we need, like, they're living in harmony.
Right, it's
and
functional
they have roles,
for our life.
But a lot of times they get out of balance. And so, in the small intestine, we really have not a lot of those bacteria. More of them are in your colon.
Mm-hmm.
So they're
we haven't gotten down
further
there yet,
things. Right? So there are some in your, upper intestinal
Well, when it's
tract.
dysfunctional,
When
you
it's
said
dysfunctional, then they
anyway,
can
we'll get into
in
that
there.
in a second.
But in the colon, that's where people think about like probiotics or the microbiome. That is in your colon, and so that's where your they're important.
This
because
is the
they
large
also
intestine.
help in the large intestine. Those healthy bacteria help with your immune system. They help. Maybe again with manufacturing or
you said
absorbing
K1 and
B12,
K2,
all kinds of vitamins, which is part of blood clotting.
Because in there, I mean, obviously, it's actually extracting out any of the liquids, right? So when it's doing it right, we're pulling a lot of the liquid
and
back
getting
out
the waste
of.
then is basically what's happening is you're getting rid of the waste in your colon. But in there's also all these bacteria that have so many roles, and we're still learning it, like hormone recycling. So too much and too little can throw your hormones off, throw your immune system off. Diabetes, they're starting to find that certain ones are really important for helping your metabolism and help you're controlling your blood sugar and stabilizing blood sugar control. So there's so many different roles that those healthy bacteria have. And I think the thing is, it's so complex. So if somebody comes in and, or if you are complaining, you're having indigestion or whatever. I mean, think about it could be the reflux or indigestion, and it could be that your stomach acid's too much. But there are so many other things, and I think
like in my case, it was
people
different.
Jump right to the antacids, and so maybe we go on and talk about the case.
Well, let's summarize real quick. So, digestion is critical to our health. Good digestion, optimal digestion. Anyway, so and it starts with seeing something, enzymes, mechanical movement. There are ways in which the food gets pumped through our body, right? esophagus, stomach, acid, more enzymes, break it down even more, and then it gets pumped down into the small intestine. And this is where we have an opportunity to pull out all the
Extract out
goodies,
all the goodies.
into the bloodstream. I think you told me there's one cell that separates.
Well, one lining, yeah, the lining of the small intestines
it
is like
an
a
interesting
cell thin.
So yeah, there's a cell, one
layer
cell,
thin.
the intelligence of it in the lining of the small intestine, and it says, "Oh, there's a magnesium. I need you," and it opens up and it pulls it into the bloodstream at some point. So anyway, so then you got that. Then you got the large intestine, the colon.
Yeah.
And now we are you're extracting some stuff still out before it is leaves the body. And so...
And all that is just, it's amazing to
I
me
know.
that it's happening without us having to like really conscientiously think about it.
Right.
But
But we also know that it is so dependent on healthy food. I mean, if everyone listening to this is just eating plant-rich whole foods, organic, non-GMO stuff, you would be in a different place.
and the right types of protein.
But who
or
does
meat.
that? I don't know of many people
know.
doing that.
Well, and it's so complex. Our environmental influences, stress, that nervous
Right.
system, crosstalk between our brain and our gut is so important.
Because I think that is a good point. So you said when the gut gets off, it can affect your mood, how your
Yeah.
brain works. It taxes the immune system. There's a lot of things, fatigue, maybe malabsorption, because you're not even breaking the food down to the point to where you can even extract anything from it. And
Yeah.
then that can lead
And
to
you can get
like
weakness
like
or muscle,
like extra goodies around the midsection of the body.
because your
People are
whole
like,
metabolism got thrown
I'm
off.
exercising, I'm doing all this stuff, but I still have fat around my midsection. It's probably your gut. You know, and who knows that stuff? Anyway.
Well, and it's so, I think there are a lot of things. The whole reason we're doing these conversations and cases is that
Because we wanted to spend more time
educate
together.
people, to have coffee in the morning and be able to chat, and to educate people on some things that you can do on your own. And obviously, if you're having some major issues, you should also talk with your doctor and work
Right.
through these things.
Yeah.
And
This is our
that's what it
conversation.
is.
We're not
But
treating people
We're not
here.
treating people here. No, that's right. We're not making medical advice. But a lot of this, what we're trying to do is help people understand, like through their lifestyle, things that they can do. This is a proactive approach so that you don't get into the problems that we're going to talk about with your case.
Right.
Because you're the patient this week.
Oh, my gosh.
I was ill last week. And so let's talk about your symptoms, and which started several years ago. And
I'm
think
usually
at the
pretty
time,
good,
you used
but
to have a gut of steel. I used to joke about that.
but
Like,
it's-
I've always
yeah,
been sensitive, and I was always like, you can eat and drink
I could
anything
eat
and
anything.
never have
I
an
know,
issue.
but it's changing now. It's more sensitive.
And I think when it first started, you were having more just kind of like some bloating and gas, what we thought was indigestion.
It seemed like
right?
it was always tied. Like every other year, I'll get a sinus infection that I get impatient with. I'm 2 weeks into it. It won't go away, and it's like, Amy, give me something, right? And then I get on an antibiotic, and then that seems to throw me off. And then usually I can get back into it pretty quick, but I think this last time, it's been a struggle for me to get this thing back. Because
And-
then it pushed into, you said maybe SIBO, which
Well,
is
and what
small
I thought-
intestinal bacteria overgrowth.
And
which
kind
is
of
so
looking
exciting.
back, we'll talk about that. But looking back, I think so. In the traditional model, I was like, I think you just need to take an antacid, and you need to quit eating
know.
like heavy, greasy food. And this
Because I was
and
getting a
that.
little
So
acid
we were
reflux.
you were
It
having
was
like some reflux.
why am I swallowing
And
all
then
the
I was
time?
like, this is years ago, and before you were working with me, your job was very stressful. And so we thought
bit.
that stress was maybe contributing. And so again, I was like, just thinking like our traditional thoughts, take an antacid. So you would do that occasionally and maybe feel a little better. And then it was like, well, maybe you need to take it for a couple of weeks. And so I was probably feeding into the problem. Sorry. Then, then we ended up, let's see. So that got better. Oh, then I know what we did. Then it was maybe
It's an
because
allergy
I
test,
will
wasn't it?
say you were a little excess gassy. Um,
It
if
never
I do say
bothers
so
me.
myself, if the I was looking this up too, and it said on average, like gas, right? Like burps or flatus, or you know, you know what that is.
Flatulence.
Flatulence. That's right. That is about what is it, 13 to 20 times a day can be normal. But if your baseline, if it's a big change from your baseline, I think paying attention to that, or if you just notice you're always like, excuse me, like burping or having gas, that might be a little light bulb that something's out of kilter. And so I think we noticed that. And then, so I was like, oh, you need to. So we did the food elimination, which that's always a great place to start. Start with the food elimination.
That was
A
that
lot
was
of people
you're
become
talking the
lactose
FOD
intolerant.
map?
No,
No,
before
not
that.
yet. Okay.
So a lot of people have a lactose intolerance. I mean, like 80% of people eventually get some level of lactose. So that's in milk and dairy and stuff. And so just pay attention to that.
I don't
because
show out allergic
that can
reactions to them,
cause-
but we cut it out, and it did help.
it can cause a lot of issues. So, it helps. Then we did food sensitivity testing,
Yeah.
GI testing. And again, that showed some imbalances in your healthy bacteria, which we weren't surprised because of the antibiotic. And we also, and you were showing some reactivity to wheat gluten
Oh,
and
was
some
I?
other
Oh, okay.
foods on that stool test.
Yeah,
So then
probably
we did an elimination of
Didn't
all
want to
that.
think about that.
And that's been a couple years ago. So it seemed like you got better. And then it would kind of come back. And then, like you said, antibiotic or different things. And then you really started noticing almost like a metallic
Acidity.
acidity to your taste or to your breath and stuff. And so then it was like, this isn't making sense. Then the bloat and the distension, and you were feeling like you were, you say you were feeling like what all your symptoms were. It was a lot of, right after you would eat, would you have like excess gas, bloating, distension?
Yeah, I mean, I think it was a little bit more of, I would still get maybe just a little bit of the acid reflux. It could feel the food going through the body, kind of just this expansion of the intestinal system.
A lot of gurgling and gas.
Yeah, and then also just the whole flatulence thing, which I think is funny,
word just
but
makes
I
me
guess it's
laugh.
not. It's not ideal.
It wasn't funny, really.
I thought it was very funny.
So
So it wasn't optimal for sure.
no. And even bowel habits were kind of irregular. And so, again, that's definitely, I mean, it's a sign that something was off. And you had actually, either you were listening to a talk or heard somebody talking about maybe you don't have enough stomach acid.
I know, right?
And I thought
The
that was so fascinating.
baking soda test.
So tell about you did that.
It's in the morning, usually empty stomach, 4 ounces of water, an eighth of a teaspoon
much.
of baking
Baking soda.
soda, stirred up, drink it, set a timer or a stopwatch. Start the stopwatch, and you should belch within 2 minutes. And at 5 minutes, I quit, and I hadn't even belched yet. And
I
you
did
did
it
it at the
with
same
you,
time, and you
and I
were
did.
around 2 minutes
Yeah.
or even sooner.
Yeah.
And so we were like, oh, okay. So you're the other way. It's not antacid. I need to do something
having
with
enough
the
acid and enzyme.
It's the betaine. Now, obviously, we're not treating. We're talking
No.
about me here, not for people to go do this.
But it was a sign. Basically, what it is a sign. It made me start thinking down that track of something called SIBO. So again, if you have low stomach acid, if you've had some digestive issues, there's so many different reasons that people get this. But the bacteria that I was talking about earlier shouldn't really. There's some in our intestines, but if you get overgrowth of bacteria where it shouldn't be, or maybe some of the less favorable
got
bacteria,
good and bad.
yeah, so you get an imbalance of the bad bacteria. You can have it where, so as soon as you eat, those bacteria are like chomping on that food and they produce hydrogen and methane. So we did do a breath test and it was definitely positive.
And I passed.
And you lit up, you passed. And that unfortunately has to be through
Which
a
is not a good
physician.
thing,
So,
anyway.
it's something you could talk with the doctor about. But that was enlightening. And so a lot of that can be treated with certain diets. There's something called a low FODMAP diet, and you
That
can Google it
had
and find it.
amazing results, like
FODMAP.
within days, very fast.
It's fermentable, like carbohydrates that are in certain foods, and it's literally in good foods too, like apples or avocados or different things, onions and grains and lactose. So that's why sometimes those things were helping you, but we weren't
Anything that
eliminating all
has
the things.
a higher glycemic or the sugar
Yeah, and it's the
substance,
type
like
of the
wine,
sugar.
I didn't really like that one.
Yeah, I know. So that's made a huge difference. And then we've just done some natural balancing with like garlic capsules and things. But again, not to treat people, but just to help you be aware that, there could be some dangers to abusing over-the-counter antacids, to
Yeah.
overdoing antibiotics, which we weren't overdoing. But again, I think,
No,
to
hardly
not
ever.
listening
I mean,
to
maybe
your
I'll
stress.
take an antibiotic every other year.
So I
Hardly
really
take
do
anything.
think our gut needs to, we need to pay attention to our lifestyle, and it's our pillars: the breathe, eat, move, sleep. So try really hard to manage stress. That nervous system, that enteric nervous system, from our brain to our gut to our brain, they talk. It's like all this nervous system that helps produce even those chemicals that help our mood and help our relaxation, and that sympathetic versus parasympathetic, which is kind of the fight or flight versus the calming, relaxing, rest, digest. If we're always in sympathetic, we shunt that flow away from our gut.
Well, actually, it turns
and
off
it
digestion.
turns off
I mean, that
digestion.
is deep within,
It's
rooted
it's
deep
survival,
within our,
right?
yeah,
You don't want to spend
fight,
your
flight,
time
freeze.
on your digestion.
You're
if
trying
you're
to run from the
trying to
tiger
run. Yeah.
versus digest. It's like, we're not digesting anything because we're about ready to be digested by the tiger.
Exactly.
Right.
So, that the breathing techniques that we use a lot, meditation, yoga, and then we talked a lot about
Which
food.
is all the stuff we do in our coaching sessions. I mean, these are the things we're building our patients up to be expert in.
And then the move. Exercise is so important for healthy gut function, to help with constipation, to help keep that nervous system balanced and stabilized. And then sleep is important too. I mean, that's a lot of our house cleaning time. And when we sleep, there's something called the migrating motor complex that works. It just kind of keeps that little nice movement. And it's almost like the sweeper through the intestines that kind of keeps healthy, keeps all the waste right out, instead of things getting stagnant and just sitting there and allowing those bacteria to overgrow. And so we need balance of all those pillars really to help.
I think another one that you've said that's really helpful too is this intermittent fasting. And I know people do different versions of it. We do a 24-hour fast, and usually it's Wednesday we eat dinner, and then we don't eat until Thursday dinner. Is generally our rhythm, and we try to do it weekly. Some people do the morning ones. It's different. Everybody's a little
some
different.
people do like a time
They
restricted.
they miss breakfast, and I'm just not big on that one. I think.
Yeah, I think
I
you
would
gotta
rather
listen to your
people get up
body.
and feed this most complex living thing on the planet, their body, when it needs the maximum amount of energy. In the absence of that, I think it works super hard to store fat on the body because it needs energy
kind of
right
in a
out of the gate.
survival mode.
I mean, how else is it going to do it? Anyway, but the 24-hour fast gives the gut time to rest, to your point, and it is eliminating the buffet meals for the bad
starves
bacteria.
those bad bacteria. I know. I mean, we're people that are constantly like snacking and eating all day, especially like sugary things or starchy, carby things. You're just constantly given food. You're
Not
right,
good.
and you can keep overpopulating
Right.
them. Yeah, and carbonated drinks and high, sugary, high fructose corn
It's
syrup
simple.
and sugar.
All you got to do is eat plant-rich whole foods only. Drink water, right?
Not plant-rich whole foods only. So, healthy grass-fed meat and proteins are good too, but
Well,
a
that's
lot
true.
of plant-rich whole
Yeah,
foods.
you're right.
'Cause
I eat
there's
my
enzymes in the healthy
briskets and
meats
all that
and
fun
things
stuff.
too. So just finding a balance, but I think it's more like whole food or like real food instead of
Okay,
processed,
you're right.
ultra-processed food. And not a lot of
But
added
for your
sugar.
carbohydrates, plant-rich whole
For your
foods are
carbs,
ideal.
yes,
is what I should have
yes.
said.
That's good. Yeah. So yeah. So anyway, you're on the road to
Yeah.
a lot better I mean, it
It's just
took a
tweaking
while.
it.
Look
I
how
mean,
long
if
it
you're
took
doing
us.
this right, we'll have to be a mini scientist the rest of our life, right? The body keeps changing. What am I, 56? And I mean, I've got a long way to go. I got what, another 64 years of life.
Yeah,
It's a
at
long
least.
way. So I mean, we got to invest in this body, and prepare it today for the future. If we want to enjoy this,
And our
this
gut
life
is so critical,
at the
so
highest level.
crucial. And so I do think just there are so many books out there. And I think, I've always talked about, like, I love Dr. Hyman's books, and a lot of it about just resetting your gut. And, he's got books on how to eat well and all that. So I think just trying to spend some time being a mini scientist, we always
Yep.
talk about, on yourself, and
Yep.
paying attention to your own gut and bowel habits and your digestive tract and how you're feeling, because it's definitely underdiagnosed.
Find a provider in your area that's doing this stuff, this
Mm-hmm.
holistic primary care, because for you as a physician, you don't get this in med school. Like, you have to go learn this
Get
on
little
your
bits
own,
of it, little
and
bits
so
of it.
you're going to need to
Yeah.
find a physician that is in that vein of practice.
Just really, yeah.
It's just
yeah.
a little different. It's a lot different than a pill for every ill. But,
Yeah, and be mindful about what you're putting in your body. From
and if you're already one of our
food,
patients,
drink.
which I think now we've kind of shut the doors for now. We have waiting lists. You can get on a waiting list, but yeah, we're not taking any more people on board. So any of you that are already on board, we're super grateful to have you. And then you get Dr. Amy's smarty pants brain
and coaching
to
with
help
you to
Of course,
really focus
I love coaching
on those.
people.
But I think
Yes.
even just spending time. I mean, our 21-day, what is it? Opt to Change.
Opt to Change.
That is a lot of it is about.
It's had
a gut
amazing results with
reset.
people.
And it's using those 4 pillars, and we really do a lot of what we're talking about here.
Right.
And so in that 21 days, I think a lot of people have noticed that, like doing that gut reset, because they are paying attention to all those 4 pillars, and a lot of it is heavy on nutrition. So
Yeah, that was
could be a
optochange.com.
simple
No, let's see. What was it? Optolivecourses.com.
Opt to Live courses, yes.
Optolivecourses.com. And yeah, you can see. And we're going to add more and more in there. There's some great ideas from some different courses that we're going to keep adding on. But the Opt to Change the 21 Day was our first one. And it would definitely help people with this as well.
I think it would be a great start.
Yeah.
All right.
All right. Well, we are wishing you guys a wonderful day. Take care.